Great. Thanks so much. Another amazing video and showcasing some of the amazing work that's coming out of Tech de Monterrey. Thanks, Arturo and Danielle. That was such an insightful conversation, and I think really sets the stage well for tomorrow's keynote remarks and roundtable discussion with Dr. Claire Millet, the CEO of Global Partnership for Sustainable Development Data. So now it's truly a pleasure to introduce our final session of the day, but certainly we've saved some of the best for last. So here you're going to have a unique opportunity to hear directly from some of the world's top students and emerging leaders. And finally, just a friendly reminder to please continue submitting your questions in the chat, and we'll bring those to the panelists after their discussion. Let me welcome the founder of the Reach Alliance, Joseph Wong. Joe is going to be joined by an esteemed group of Reach Alliance alumni. Program coordinator at OISE here at the University of Toronto, Perri, incoming analyst at Deloitte's Future of Canada Centre, Eric, Chief Marketing Director, Travelers with a Cause, and member of the first research team coming out of Tech de Monterrey, Marisa, and the business analyst at McKinsey & Company, Jasmine. Joe, over to you.
Thank you very much, Maren. It's an extraordinary opportunity. I'm so thrilled to be joined by these four terrific Reach researchers. Let me first of all begin by congratulating all of you on the just extraordinary work that you've been able to produce as part of the Reach Alliance. I had the pleasure of reading all of the reports. These reports they're rich in terms of their empirical detail, they're insightful in terms of the lessons learned, and they will no doubt be impactful in the world of practitioners, particularly in this space. So congratulations to you all. It's also really inspiring for me to have an opportunity to chat with all of you. Some of you have actually even been in some of my classes before, so it's really great to see you now in these real positions of impact as you move forward in your careers. Marisa, actually, I want to begin with you, and we want to keep this conversational. So, Marisa, I wanted to begin with a question to you, actually. The report that you and your team did at Tech de Monterrey, I think, is just incredibly insightful, again, very empirically rich. What were some of the key barriers to reaching the hardest to reach in the work that you and your team did?
Thank you, Professor. Hello, good morning to everyone. Thank you for the introduction and the invitation to come speak today on behalf of my team. I would like to emphasize that it is a pleasure for us to be the first Latin American team in this alliance, and we are really delighted to be here and learn from all of you. And regarding that interesting question, I would like to highlight that sometimes we have this idea that the communities hardest to reach are on the other side of the world, in the poorest countries on the outskirts of the city. But what happens when a community that is in extreme poverty without access to any basic services is located in the urban area in the middle of one of the wealthiest cities of Latin America? So in our research, we verified that the hardest to reach are closer than we think. Although they are difficult to reach, they can be on the corner, on a very small street without paving or street lining, next to large companies such as Mercedes-Benz. So I think there it is when they are really hard to reach due to this economic inequality that ends up making them completely invisible. In our case study, we had the opportunity to work with two incredible migrant indigenous communities living in the urban area of Monterrey that faced a common challenge that they were living in irregular settlements. And this particular lack of legal recognition created difficulties for residents obtaining basic services or identity documents. So I would like to highlight that in addition that they are in this legal limbo, institutional obstacles and inadequate processes are also a major barrier to reach them. Even though the government is familiar with the hardships they face, the design of their initiatives to target these particular hardships often lacks of precise knowledge of people's struggle. And also there's, in my opinion, a strong institutionalization of informal racist and classist practices. For example, community members had gone up to 6 times to INEA, which is the National Institute for Adult Education. And then they have failed 6 times because part of the entry requirements was to fill out a written book. And since they don't know how to read or write, they were told that they couldn't access because they couldn't fill out the form. So they are involved in a conflict between what is legal in terms of regulation versus what is legal in terms of human rights.
Mm-hmm.
Another big point about this is that their access to basic services has been strongly influenced by the involvement of politicians and political parties, looking to secure their votes in the local elections, saying, we will pave the roads and provide safer land while you provide the votes. So in order to receive what they are entitled to by law, they must be affiliated to a political party. So I want to end my point with this. I think that in order to really reach them, we need to switch from a clientelistic trade of perspective to a human rights approach, where we might never forget that at the end, we're talking about people with dreams, insecurities, problems, beliefs, and cosmovision. So I think that they should be at the center of the analysis and of all the programs.
Thank you so much, Marisa. I mean, I think you raise a really interesting insight there, because oftentimes we think of those who are hardest to reach as those being the most remote or the furthest away. And what you're talking about really is a kind of invisibility and indifference, and indeed even, outright racism, and the active exclusion of people from societies as another kind of barrier to reaching those who are hardest to reach. What about some of the other researchers around this table? What are some of the ways in which you encountered this question of reaching the hardest to reach and some of the obstacles therein? Feel free to just jump in.
I'll jump in right there, because like something Marisa said about urban populations being hard to reach really sort of sticks out to me in my team's research. So for some context, we looked at Google Loon and their operations of providing internet connectivity to hard to reach populations in Peru between 2014 and 2021 before they shut down. And we actually found two distinct populations who are hard to reach. So similar to Marisa, there are these urban centers who are very hard to reach due to natural disasters. And the other population we found is that these are isolated communities in the Peruvian Amazon who are just geographically located, who are just geographically isolated from the rest of the country because of their situation of where they're located. So those two distinct populations really show these two distinct traits of hard to reach people. But there's sort of this unifying thing. A lot of times from our experience, from our research, we found that hard to reach people are really just because of factors outside their control. So for example, natural disasters, they can't control when a natural disaster hits. Being geographically isolated, they can't necessarily control where trees grow, for example, where the mountains are. They can't control those things. So oftentimes barriers to reach are really just sort of these factors that outside the population's control. And like, from my perspective, I really and genuinely think that it's really up to us as researchers, innovators, and policymakers to mitigate these factors as they hit these people.
It's really interesting. We heard earlier on one of our speakers talking about how systems have been shown to be so vulnerable in the face of COVID. And it got me to thinking about how systems are built for most people. But they're not built for all people. And one of the things that we've seen, what these disasters and pandemics and unpredictable events have highlighted, are the ways in which our systems are ill-equipped, in fact, to reach those who are hardest to reach. And indeed, as we think about the SDGs, they're ill-equipped to reaching everyone and ensuring no one is left behind. So I'm going to layer on another question. Feel free again to look at this question of the barriers to reach. But I actually wanted to turn this to Perri. One of the things that really struck me with Marisa's comments was the real active, through racist behaviors and attitudes, the real active discrimination against people. And yet, in the case of the work that they were doing around indigenous communities in urban settings. And yet we know, and certainly this was one of the things that I was struck when I read your report, was the importance of trust, right? We need to have trust between the different actors and the communities themselves, right? We heard again that this morning, there has to be a real genuine engagement with communities. Where does trust fit into your analysis and the work that you and your team did? And importantly, how do we generate that trust when, frankly, if you've been excluded forever, why would you have any trust in the system, in the actors, in the stakeholders, and so on? Perri, why don't I turn it to you? And again, Colleagues, please just jump in when you have a response. Perri.
Thank you very much, Professor, and thank you to my colleagues for their comments earlier. I think it really actually feeds into this piece of the conversation wherein, trust is the currency of interactions, and it's necessary for innovation, and something that we learned through our team's research, which my wonderful colleague and teammate Huen actually described in the earlier roundtable, is that it's something that must not only be built but earned incrementally and iteratively over time through day-to-day behaviors, and also sort of a proof of an evolving culture and business model in some ways when it comes to partnerships. And so when we look at the idea of trust, specifically within what our team investigated, as Huen mentioned, being good practices and habits of cross-sector partnerships, particularly for global health and vaccine deployment, there is a sort of preceding element of vulnerability, and also this inevitable element of the unknown that exists within trust. Something that Marisa and Eric actually both commented on before is trust in and beyond the level of humanness and relationality. And one of our informants from our particular project, looking at sort of the spectrum of cross-sector partnerships that exist in global health, they mentioned that a common misconception is that trust is built with an institution. And while that is important, earning trust is with an individual champion actually is far more likely to lead to successful co-creation, problem solving, and the kinds of actually positive emotions stimulated by interpersonal interactions that contribute to deepening trust. So there's kind of that positive feedback loop where we can focus on an individual champion beyond simply just trust in an institution in order to push that forward. But there are a few ways that we can look at this in practice. One of them being digital translation and empowered engagement. So through informant interviews, our team noted that double bookkeeping, for example, is one example of an issue with digital health solutions, meaning that local healthcare workers were reluctant to use it, this digital intervention, as it complicated their process rather than simplifying it, and felt like it was outside the scope of their practice. So in this sense, staff in these areas may have felt mistrust of new digital technology, given that the process of its adoption wasn't properly cared for on the ground. And what's so important for this is actually adequate and balanced resourcing. Resourcing being, the age-old challenge, but really resourcing is something that helps address the demands that partnerships put on on-the-ground implementers who navigate relationships within the community and provide that in-person level of care to healthcare workers encountering a new technology. So that's one key piece. And another one I'll just mention is overall, something you also alluded to, Professor, is nothing about us without us. And so stakeholders, especially healthcare workers, may be distrustful of foreign top-down actors, especially major institutions that have harmed communities through unethical experimentation in the past. And so when we look at something like nothing about us without us, we did have an informant that said, one person, when we look at the colonial past, this may be forgotten by those of us in power, but it's not forgotten by those who have suffered it. So at its core, it demands nothing about us without us demands that no policy or intervention should be decided by any representative without the full and direct participation of those whom the policy affects. And I think that contributes to the conversation around trust.
Yeah, I think it's so important. It's a really terrific insight that you raised, because oftentimes in our analysis, we think about things as actors or stakeholders or institutions, right? They're faceless. They are variables in our analysis. And what you're pointing to is the imperative of the sort of the shared humanity, a human face. Tomorrow we have this terrific fireside chat featuring Lynn Innes, who's the president and CEO of the Winnebago Area Health Authority in Northern Ontario, and Homer Tien, who led the vaccine rollout for remote Indigenous communities. And there, the story is all about people and individuals and earning the trust, because as we've been told by many of the folks that we've interviewed, these are communities within Canada that have every reason not to trust. And how do you build that? And how do you build that with with genuine intentions and the patience that's required. Jasmine, you've done work in both the public sector and the private sector, and you are now, of course, with McKinsey and part of the private sector, but no doubt thinking about projects that probably bridge these different sectors. Where does trust fit into your analysis? And I'm just curious, as a consultant, is that something that you think about and that you factor into the models that you work with?
No, 100%. And I really related to the answer and experience Perri gave from her research, because our team found some similar themes. And just for some background, our project was based on the UNDP Solar for Health initiative in Zimbabwe, solar powering health facilities in very rural areas. So in the worst conditions, think about pregnant women giving birth in the dark, surgeries taking place without proper lighting. Those are the kind of situations the project set out to eliminate. And the way I think about trust is similar to a car, actually. When you think about it, it can depreciate in value very quickly, and you have to put in a lot of work just to maintain it. And I think a couple of the things that we saw within our research that supported gaining trust with the community, and our audience was the hospital, the clinic staff at some of these facilities, was if you want trust from the community, you need to involve the community, right? So the Solar for Health project actually made it a requirement that it be local subcontractors to be the ones to provide maintenance, as well as to be the ones to train some of the clinic staff to know what to do in certain situations, to conduct some preventative maintenance, to know, to have some sort of independence also within the program. And that's another component, I think, that helped build trust, helping people help themselves, so that they know that we're not just dumping solar panels at the door, but this is something that you can actually believe is going to be here tomorrow. So I think those are a couple of the different things that we found that supported trust, and also reflect what you had just mentioned about people who have every reason not to trust, being able to, by seeing themselves, by being independent.
That's great. Terrific. Thank you so much. And I love the metaphor of a car, because it's not just about earning a car or earning trust. It's really about maintenance, right? It's really about sustaining this trust and earning the continued maintenance of this trust over time. Indeed, this is one of the things that I think is really interesting about REACH projects, is that they're not only interested in just the initial implementation of a particular intervention. We do have the opportunity to look at these interventions and these projects over time, to examine them over time, to really understand the life of these projects, the highs and the lows, the ebbing and the flowing over time, with, of course, an eye to the question of longer term sustainability, right? And how do we ensure that these initiatives can be sustained over the longer term? I want to turn it to Marisa right now, because I think this is something that she's thought about a lot, and you can certainly see this in the work that they're producing. Marisa, why don't I turn it to you first? And again, others, please jump in when you feel like.
Thank you. I actually loved the example about the car, and I think I would like to add to the conversation that I think it's really important to promote a long-term relationship of trust with social promoters. We learned that this prolonged presence of NGOs created kind of a base of security for indigenous people, but when an NGO leaves, it creates a feeling of resentment within the community. So what happens is that they end up closing themselves off from external support. So this long-term relationship with social promoters and NGOs has helped to reinvigorate, for example, their indigenous identities and acceptance of their language, also encouraging them to address public agencies to advocate for their rights. Also, something that helped us to especially build trust with the community was through a gatekeeper, someone who knows the community and whom they trust. So it works kind of like an intermediary arbitrating the access and guiding us. So in this way, members of the community could not only granted us interviews, but also open to us, trusting us, and teaching us far more than we could have hoped for. And in addition to what Perri and Jasmine mentioned, I think that especially this lack of trust in our case study, it happened to us when we first arrived to the community. The social workers and NGOs described the situation of one of these communities as hopelessness. And it wasn't because they were negative, but because they had been shown that they couldn't access to any human right because they were indigenous, taking it specifically as a cause-effect relationship. And the authorities who are supposed to ensure their well-being and their development turn their backs on them. So I think that here it's when rebuilding the trust shouldn't come from a community effort, but from an institutional and organizational effort in which we need to create more direct and efficient processes, examine how we can simplify the processes as much as possible so they can actually reach everyone, and that really no one is left behind.
Mm-hmm. You know, it's really interesting. I mean, one of the dynamics that you're also referring to is the need to be continually learning, and not only learning how to do things in the first instance, but learning how can we do things better, right? And we can continually refine. And so I recall in one of the earlier contributions to the chat, Dr. Stan Zlotkin noted that, you know, it's important also to learn from things that don't necessarily succeed. Because the lessons that are learned from that can be in the service of ensuring longer-term sustainability. And Eric, I was wondering actually if you wanted to just quickly comment on that, because Google Loon, of course, is a project or an initiative that in the end did not succeed, but has laid, I think, and maybe you can elaborate, the seeds of some really important lessons moving forward in terms of a long-term sustainable solution.
No, thanks for the question, Joe. It really does actually serve, it's at the heart of our research, the question of how do we transition from a short-term disaster relief service provider to this long-term sustainable project that really sort of supports these isolated communities and those who are really hard to reach. I mean, from a project sustainability perspective, like our research really came to the conclusion there are two main factors that determine it. One is determining the viable business model that really services those who are in need at your target population. So really figuring out who your target population is and designing your model to meet the needs of those people. And number two, it actually is effective stakeholder alignment, which goes back to the previous question about trust. And I'll get to that in a second. So starting with the business model perspective, I think it's actually a very interesting dilemma. I think many of us have examined public-private partnerships. And this dilemma that I find really interesting is that the private entity of this partnership obviously wants to make money. Like these private companies, sure, especially within telecommunication systems, they're there to make money, and that's sort of their end goal. That's the bottom line. But there's also this moral obligation we have as policymakers to provide a public good to those in need, such as interconnectivity. I think everyone can agree that that this recent pandemic has shown that interconnectivity is a public good. Like we need interconnectivity to go about our day-to-day lives, be it socially, economically, politically, environmentally. It's just internet connectivity is so ingrained into our day-to-day institutions and our day-to-day actions. So when it comes to when we examine these rural areas, it actually becomes very clear that from a business model perspective, it's actually not that viable. It's this clear example of actually diseconomies of scale. And Joe, you and I have spoken on this in the past as well. It's Loon's balloon, like the balloon systems that Loon use, they could operate at a sort of diameter circle of about 30 to 40 kilometers. But the difficulty in these rural areas is that might only service 50 people in total within that area. That's just too much of an upfront cost to those consumers to pay for the services that Loon's providing. So we immediately get into this idea that it's just not a sustainable business model. The next question is, with regards to the business model, is actually how do you get that good to those people? And that becomes a question of technology. So for example, Loon's balloons, they were relying solely on 4G internet connectivity and with a hope to go in towards 5G. The difficulty is a lot of these rural communities only had the devices, so cell phones or tablets, capable of 2G or maybe even 3G technology. So there's this gap of the supply meeting the demand because it just wasn't lined up. So there's this greater question of like, okay, does the technology you're using meet the actual the need of the consumers? So that's from the business model perspective. From a stakeholder alignment perspective, this actually really comes back to the idea of building trust and making sure people are in agreement of what the actual outcome is supposed to be. So I loved Jasmine's analogy of the car in trust building. I normally thought of this trust building as more of akin to a relationship between two people, for example. We want to define expectations right away and then establish sort of real good channels of communication to make sure those expectations are met, such as like, what is the outcome we want? How are we going to get there? What channels are there for dispute resolution? We want to create that trust, facilitate that trust between the partnership itself, as well as from the people who are facilitating the public good to the consumers themselves. So for example, Loon or the government of Peru has to engage with the needs of the consumers on the ground in order to tailor exactly what they can give to them. So from a sustainability perspective, it really just comes down to determining a business model that's appropriately meeting the needs of the consumers, as well as making sure and facilitating that trust, communication, and alignment on expectations between those who are in the partnership and those who are receiving the public good.
That's terrific. Thank you so much, Eric. And it's clear that from this project in Peru, there are some important actionable lessons that emerge from that. I just have one last question for each of you, and I'm going to ask you very quickly to comment on this. But let me preface it by saying this. A few years ago, one of our REACH case studies was on the elimination of mother-to-child transmission of HIV in Thailand. And soon after that report came out, I got a phone call from UNICEF, and they said that they wanted to feature that report in all of their field offices. And I said to them, I said, well, you know, this is research that was conducted by students, right? And they said, yes, absolutely. But this is the world's, this is the world's first, the world's best research case study that we've seen on this topic. And we insist that it become standard reading in all of our field offices. This work was having an impact, a real impact around the world. In the course of your experience with REACH, you all came in as students involved in this very, very, high expectations project, but nonetheless, you came in as students. At what point in the process did you think to yourself, gosh, this work is going to potentially have a real impact in the real world? And I'm going to ask you to very quickly convey to us your sense of that. I'll start with Jasmine.
No, great question, Joe, because I actually did reflect on this quite a bit during our research. And I think the point at which I realized the impact that we were having is when we were having these conversations with the program managers. In my case, it was UNDP Solar for Health. And we were actually doing analysis to show that penetration amongst the hardest to reach populations in Zimbabwe with this project was the same as penetration with some of the relatively easier to reach populations in more urban centers. And that was something that they hadn't done yet. They had the headline stats of how many facilities that they were at, but going that level deeper was something that they had never done. And also, another piece of analysis we did was showing the difference in childbirths in hospitals in certain areas with these facilities. That was something that they hadn't gotten to yet because they're busy executing. They don't have the time, resources, the platform to record these insights. And you come in as a student thinking, oh, what do I know? Not being an expert in the space, but really you can know a lot. You can find out a lot. And I think that was the point at which I realized the impact.
Thanks, Jasmine. Absolutely. You are experts. I mean, there's a lot of people out there. I know there are hundreds of people in the audience who are experts in their own fields. But when it comes to the specific case studies that you worked on, you are the experts. In the interest of time, I'm going to turn it to Perri, and she'll get the final word on this in terms of the impact.
Thank you, Professor. I think there was a really interesting sort of micro-macro connection between our team and the study of interpersonal relationships within teams for global health. So I think one of the moments for me is when the puzzle pieces started coming together between gathering insights from informants who were comfortable, one in particular very comfortable sharing their frustrations, but also their triumphs, and then bridging that with some of our learnings as a team, and also having the incredible support of our faculty mentor, Eric Ruggiero, and really sort of honing in on the fact that SDG 17, collaboration and partnerships, is a really important conversation that we need to grow and nurture. We were able to help contribute to that conversation.
That's great. Thank you so much. And I know that Eric and Marisa also have insights to share, but unfortunately, for those who can't see the back end, there's this huge, all caps, all bold, time's up at the bottom of my screen right now. So I apologize. And frankly, I apologize on behalf of everybody, because I know that people wanted to hear more from these four really just amazing, amazing leaders. So I'd like to thank the four of you. It's been a real pleasure to chat with you today. It's been a real pleasure to chat with you, frankly, over the years, and I look forward to many more. I'm just going to close things up now, so thank you all again. So this concludes our first day of the REACH Symposium. It's been just an incredible set of discussions that we've had today. Some of the themes that jump out at me are, we need to be listening, but not just listening for listening's sake, listening for action. And how do we turn the lessons that we learn, not only in terms of how to do things, but frankly, how to keep doing things better. I thought one of the great insights from one of the students we just heard is that these solutions are not one-shot solutions. They are relationships. They are a car. They need to be maintained. They need to be sustained over the longer term. And we're only going to be able to do that if we align the different sectors. Not just the incentives, but the very valuables and principles that bring different sectors together. Until we do that, I worry that we're going to be treading water. At the conclusion of this day, I'd like to thank the entire REACH team for just putting on an amazing show. Marin, Fadumo, Filsa, Moni, all of the guests who participated today. Your contributions and your participation are much valued. And of course, to all of the researchers. You had a chance to meet several of them today. We wanted to be sure that they were featured prominently throughout the program. I'm sure if I could see all of your nodding heads right now, you are all nodding in agreement that the REACH researchers really are the stars of this show. All of this is to build excitement, to lay the foundation for what we're going to see tomorrow. We have a very insightful welcoming address from Michael Froman, who of course heads the MasterCard Center for Inclusive Growth and the Impact Fund. We'll have panels around, again, data for development. We will have a panel, a really interesting discussion on mitigating global health shocks, and we'll also have one on Indigenous health. So thank you all again. A terrific start to the symposium. Incredibly grateful to all of you. Enjoy the rest of your days, your evenings, the rest of your mornings, and we will see you tomorrow. Have a good one. Bye now.